Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified a bunch. It's a little bit hard to see because there's so many things that are torn right now, but it won't take very much work to clear up the picture. The shaver's coming in. I'm going to turn it on and put it on oscillate and put on a little bit of suction, and right out of the gate, that's going to take away some of this torn labrum and some of the torn rotator cuff, which is what I'm working on right there. And now we can kind of get a look at what's going on. So here's the biceps tendon to the left, behind the biceps, and at the top of the screen is going to be the rotator cuff tear. That's just a hole going out. So the rotator cuff's definitely torn, which is not a surprise. We knew that. The biceps is a little more torn than we were hoping, but we have an answer for that too. We'll go ahead and look down. We'll take a spinal needle and we'll pass it through the biceps. We're going to secure it with a suture because later on we're going to do what's called the biceps tenodesis. So here's a spinal needle going right through the middle of the biceps. We're going to pass a, hold the camera there. We're going to pass a kind of nylon coated wire called a super shuttle right through it. We'll take a grasper. If you look on the screen, the grasper is going to grab that relay, and then we're going to back the needle out. And now as we pull the relay through, we'll be able to load it with a suture. The relay has some holes in it, and we load the suture through one of the holes. So if you look very carefully here, you'll see that. There's the hole, there's the suture. And so now we're just going to do that same thing one more time to secure the biceps. Pause, please. Okay, so this is the AC joint. We've already done a little bit of a resection there just to give you more space. This was a place that was sore. I'm going to turn up the pressure a little bit to give us a better picture. Okay, and so as we look here, here's the edge of the clavicle. We can put the burr in between the clavicle and the acromion, and there's plenty of space here. A lot of times we'll push and look down through the back, and we can see, I'll take a little bit more bone on the left here. Again, on the left is the acromion because the camera's coming in the front of your shoulder right now. Now this is probably our best shot down the 50-yard line. We can see the clavicle on the right, the acromion on the left, and we've got good space between these two bones now. Okay, and so now we're ready to go back and get to work on the rotator cuff tear. Let me give you that, put the shaver back on. And this is the big hole in the tendon. So we're going to clean up the loose edges so we can see exactly what we have to do here. Okay, so here's the repair now. We're back looking lateral. This is the posterior aspect there. The hole is completely covered up with 3 side-to-sides and 2 anchors. And then there's the biceps anchored down right there. And so now the last thing we do is a little biology trick where we're going to make some little holes in the bone. Go ahead and tap me down here. All the way down to the hub. Keep going. Okay, good. And so there's one hole. This just opens up the bone marrow space. And we'll see if there's room for another one here. Yeah, I don't want to do another. Our pop lock anchor is close to that. So I think we're good there. All right, we're going to finish up and get you back to the recovery room shortly. Bye-bye. Okay, we're all done here. We've switched the camera position just so you're oriented. The camera's in the back, medials to the left, laterals to the right, the front of the shoulders straight ahead. And now we can show you we've also tenodesed the biceps. There's the anchor, and that's the biceps tendon just behind it. As we rotate, I'm actually going to try and, I'll move the camera so you can get a better shot of the cuff in 1 second here. Okay, so I just want to give you an interval report. We've now done 3 side-to-side sutures. They're kind of lined up right here. We've tied all 3 sutures from the first anchor. You can see those 3 right there, holding down the posterior part of the rotator cuff, which is called the infraspinatus. And now we've got another triple loaded anchor here, and we're going to use these sutures to tie through the remaining torn edge. The biceps tendon's still over here to the right. So we're going to go ahead and we actually may have a little bit better stitch if we go with the turn to the left and take our sutures out the back. And so we're going to reach in from the back of your shoulder here, and we'll take this stripe suture first. Okay, so we've got our suture anchor down. It's triple loaded, which just means that there's 3 different colored sutures to work with. We're going to reach in. You can let go. We're going to reach in, decide which one we're going to use first. Typically, we look for the one farthest to the left because that's where our first stitch is going. So we're going to take out that black and white striped one. You can kind of see what we've done there. And now we're going to take a suture hook and bring that in back here. So we'll show you a little more in a minute. Okay, so here's what we've done so far in terms of the tendon repair. We've placed 2 side-to-side sutures. There's one of them. The other one's right next to you. See, there's a white one, kind of a blue one. And you can see how that functions as almost like a zipper, the beginnings of a zipper to zip up that tear. And now the hole's a little bit smaller. We've still got to put in some suture anchors to get this tendon to cover some of this kind of yellow, orangish part of the rotator cuff footprint. And then the sutures over here, those are from your biceps tendon. We're going to be dealing with those at the very end because your biceps is right there, okay? So we're making good progress. I just wanted to give you kind of an interval report. We're going to take a spinal needle next and decide where we're going to place our first suture anchor. Okay, and that looks pretty good. I like the angle. There's the articular surface down here. We don't want to place anchors there. That's right where the articular surface stops, and so we're going to come back about 5 to 7 millimeters and place our first anchor right about here. And so that's what we'll do, right? That looks like a pretty good spot there, guys. So pause, hold the camera here.